Hey guys, in this video we are going to cover paroxysmal nocturnal hemoglobinuria. So normally GPI anchor proteins are present on the surface of the RBC, and the main function of this GPI anchor protein is to anchor CD55 and CD59 on the surface of the RBC. CD55 is also known as decay accelerating factor, and its main function is to prevent C3 convertase formation. And CD59 is also known as membrane inhibitor of reactive lysis, and its main function is to block binding of C9, and that is why there is no membrane attack complex formation. So in toto, CD55 and CD59 prevent complement from attacking RBC, and this GPI anchor proteins is coded by PIGA gene, and this PIGA gene is present on the X chromosome. Now coming to its pathophysiology, so this disease is due to acquired mutation in the PIGA gene, and because of this mutation, GPI anchor proteins are not coded, and that is why there is loss of CD55 and CD59 from the surface of the RBC, and hence the complements are not inhibited, and this leads to complement mediated intravascular hemolysis. And these GPI anchor proteins are also present on the surface of neutrophil and platelets, and that is why in this disease there can be destruction or dysfunction of neutrophil and platelets as well. Now coming to its clinical features, so normally at night time there is relative acidosis in our body, and this relative acidosis promotes complement mediated hemolysis, and that is why when the patient wakes up in the morning and goes for toilet, he observes that his urine is dark, and that is known as early morning episodic hematuria. And because of the destruction of RBC, there can be anemia, and the neutrophils or platelets can also be destroyed, and that will lead to pancytopenia. And there can be dysfunction in the platelets, and this will result in thrombosis, and this can give rise to deep vein thrombosis, stroke, or Budd-Chiari syndrome. And sometimes this disease can also transform into aplastic anemia or acute myeloid leukemia. Now coming to the diagnosis part. So this disease is definitely diagnosed by flow cytometry. So in this we are going to find CD59 and CD55 concentration on the RBC. So in the normal person, most of the RBC will be present in this corner. But in PNH, because CD55 and CD59 are less, they will be concentrated in this corner. And earlier, HAM test was also done for this disease. Now coming to the treatment part. So in this disease, there is overactivation of complement system, and that is why we give an antibody, that is a monoclonal antibody against the complement C5. And this antibody is known as eculizumab. So with this, thank you for watching, and for more videos, do subscribe to this channel. And any suggestions or any queries are always welcomed.